success. So those of you in the audience, if we could just go in and take a poll, what are the biggest elements that you experience in your value-based contracts? Is it ensuring interoperability across your network? Is it empowering providers with insights at the point of care, the way we just heard? And then, or is it the use of analytics, either to stratify to find your high-risk patients, or for reporting, getting a good dashboard to take a look at, retrospectively, and currently how you're performing. Let's circle back to both of you while the audience is taking this call. What have been the biggest drivers you think that are going on for other people in this ACO and value-based care market? Anna, let's start with you.
Yeah, the most crucial element of success, I think there's many levers when we're talking about value-based care, but I'm going to go back to that foundation, which is the data and analytics that feed your ability to make those actionable decisions on the care and who to provide the care for. Resources are finite. And so we have to understand who needs the care, what kind of care do they need. This is all crucial to success in a value-based contract. So I don't know if I could choose one of these because they all are levers of success and they all kind of feed on each other in making you successful in a value-based care. The foundation is having the data and analytics to make that happen. So if you had to start somewhere on your journey, maybe you need network-wide interoperability. Maybe you don't because the claims give you the 4 main data points that you need to be successful in your first year. It all depends on the contract that you're in and what you're managing, but all of these things matter in being successful in a value-based care.
Tamara, it sounds like these things all work together and it depends where you're starting in your journey.
Yeah, I was going to say that I think we've, really been doing this, like I said, for a number of years. And what we realized, I think, is that each of these probably is a growth point, and we didn't start with network-wide interoperability. We started with retrospective reporting and then moved into network interoperability. So, and one of the things I would just state is when it comes to understanding some of your data points, I think really focusing in on 4 or 5 data points is, I would highly encourage that instead of overwhelming people with 20 or 25 data points so that you can get good in an arena. And once you've mastered that point, it's time to add a new one to the group. So less sometimes is more in that area.
Well, we don't know.
I'll second that for Tamara. You got to start somewhere, and that retrospective reporting is certainly a place to start.
We don't know where our audience are. I'm sure they're at various points in their own journeys, but let's check in and see what they see as the most important here and pull up these poll results.
Ooh, very interesting answers.
Tell me why you say that.
Because I will say that as a health system, we are thinking network-wide interoperability is going to get us to success in a value-based contract. But the foundation is having the data and information to do that. And so when you think about what that means, it's the intelligence, which is the use of analytics and retrospective reporting. That helps drive where your finite resources are going. So I have to agree with Tamara on that one being probably your first layer in your journey and being successful. That longitudinal patient record of care, I don't know what we call it, the Mecca for patients is complex, complicated. The standards are emerging. We're not there yet, even in national laws. So it's hard to do. And I think it's interesting to see the audience focus in on something that's not a foundation and what has made others successful.
Well, I was going to say that, that's a great perspective, and certainly you've been doing this for a while at MultiCare. Let's move on and talk a little bit about MultiCare as an example, as a case study. But first, I want to say make sure I got this right. PSW is the population health engine, and MultiCare is the delivery system. So let's get into talking about a nice case study around MultiCare and how the delivery system plays out with the population health engine. So tell us a little bit about MultiCare.
Yeah, so MultiCare is based out of Tacoma, Washington. We serve many communities in Washington State and beyond the Pacific Northwest. We have a physician-led accountable care organization as a part of that entity. And MultiCare Connected Care specifically is a subsidiary of the health system. So we are the ACO and the Pop Health engine that partners with PSW, our small but mighty team, we call them, to enable us to be successful in value-based care. We're at risk for over 270,000 lives, and we have about 3,800 plus participating providers, both independent and owned through MultiCare Health System. We are a strong advocate of sustaining independence in the community, and this network of providers enables us to deliver on that. We participate in all different types of value-based contracts, from federal to state to commercial. Those are all of our portfolio of work. So that's a little bit about who we are and what we're made of, our recipes.
No, that makes sense. Can you say a little bit about the percentages? Like, to what degree are you doing Medicare, which I assume most of the federal, Medicaid, which is probably most of the state and commercial payer contracts as well for value-based care? What's the general fallout? What percentages in those buckets?
Yeah, that's a great question. I'm trying to do the math off of my head. Yeah, right. It's probably heavily commercial, but when we talk about like our main contracts that focus on the biggest portion of revenue that comes into our system, you're probably equal parts commercial, federal, state in all of those. So they're just different in how we move through the system. However, we use the same foundations to do the data aggregations, to move the lives. The things that we specialize in is what waivers in that contract, quality measures in that contract. We hone in on the different things. But now that I think about it, I'm thinking, yeah, they're probably like 25, 25, 25 if you do the math.
Got it. So a real clear balance between all three.
Yeah.
And, you've got over a 250,000 lives and 3,800 providers. That's a lot of folks that orchestrate.
Yeah.
So,
and about, 45 EMRs in that network.
Oh my gosh.
Yeah.
Lots of systems and silos to orchestrate as well. And so how do you pull together the group in terms of thinking about a common mission?
Yeah, so our mission is partnering for healing and a healthy future, and MultiCare walks that mission every single day. That is why we have a network of both employed and independent providers. We're partnering with the community to make all of this happen. It takes a village to do that. And so our mission is really around partnering with entities to enable our patients and communities to live that well-being life we're all searching for. So when we go out and talk to our partners, we ensure that they can walk, they walk our values together. It's a high trust relationship and want to live our vision of being the leading catalyst of patient and population-centered value in the Pacific Northwest. So ensuring that our partners want to do that with us and be in the journey with us is a curation that we take very seriously. And we believe that everyone that is within those 3,800 providers are all along for the journey in doing so.
Well, I can speak for myself. As a technology company, my organization has really enjoyed partnering with both PSW as a population health engine and with MultiCare and delivering care to such a significant percentage of the population in the state of Washington. We just finished a year of a pandemic, and partnering with both your organizations, arguably the index case started in Washington. So you were early at that forefront. Mm-hmm. Now we're dealing with this issue of how do we get a vaccine in everybody? We've had tremendous scientific results with creating these innovative vaccines that are highly effective. how have you, let's take a look at how have you used data and information in such a platform and work together as the two organizations in ensuring this vaccine rollout?
Yeah, so I'm going to go back to the poll, tie this back to the poll. So there was, I think, one option about high and rising risk, which is a key lever in being successful in value-based contracting and keeping our communities well. And immediately, I think in March and April is when we said, hey, Innovaser, can you help us identify who we need to call, who we need to get to as we all are isolating in our homes, who are our high and rising risk in our entire patient population. So we went from only people in value-based contracts to the entire, anyone we had touched in the 3 years, true population health, if you think about the flywheel, of population health. So looking at all of the society and people we serve, figuring out who we're going to work with to pick up that phone, ensure they're getting the care that they need. That was step one. So when the vaccine rollout came along, we asked Innovaser again, we need help managing this. We need to know who has their first shot, who has their second shot, who needs this shot most and hasn't gone to the clinic to get their shot, who needs us to go to them in our hospital at home model or our health at home to get that shot because they are self-isolating and they need to. All of this intelligence was enabled by the Innovaser platform to get that data that had already been established for our value-based care. So here's the cool part. You have a platform, you're working value-based care, and now you have an opportunity to scale it to an entire society, Washington State, or all the patients that you touch. So it was an opportunity that Innovaser partnered with us to make that happen, to enable us to do the outreach to the patients who need to get the vaccine the most, keeping our vulnerable protected. And then also monitoring our progress. How are we doing? Who needs another shot? Who didn't get the follow-up appointment? All of those are actionable data points that we need to make decisions in order to ensure that the right shots are going in the right arms as we need it as a society, which is really powerful in what this platform can do for us. And I think we did that in a matter of 4 weeks or less. Tamara Ryman cross-checked me on that because we already had the interoperability in place. The plumbing was done. And so it's really just turning on a switch and producing the intelligence that we need to do. So pretty powerful and really impressive in the way that we can, help people get through this. Let's return to our new normal. I'm not going to say it's a normal, but helping us get there.
And I would just add that it was the flexibility of Innovaser, in that 4-week turnaround time to be able to, hey, we have this use case. Are we going to be able to do this? And when Anna references we, it's a collaborative we. It's all, the representatives on this call, all 3 of us just came together and turned that around in a 4-week time period. So pretty impressive and pretty flexible when you all of a sudden identify your population health tool can actually make a difference in an area that you hadn't initially thought about using it for.
This sounds like real teamwork. You've got technology, population health engine organization that's helping to empower providers, provider organizations like MultiCare, and then being able to have all that data and information to really manage a population. 1.8 million active patients. It's a lot of patients. It sounds like
it's about, I think we're 7 point something in Washington State, so it's a pretty significant part of the population.
So we've got a history of managed care, accountable care organizations, technology coming together to help make these things work, partnerships like you've described. Really, I think the pandemic may have a silver lining of helping get us to a point of really being able to move value-based care and population health into the future. I just think that's a very exciting vision that the two of you have painted out. Let's check in with the audience and see what they think the future of value-based care programs will be. The Biden administration has talked about, from a government standpoint, of pushing out more mandatory participation in these value-based care contracts and moving away from fee-for-service, which has been the slow trend. ACOs and bundled care payments may continue to evolve slowly and incrementally the way they have been, or there may be market consolidation, new partnerships and new networks, kind of the private market doing this on their own and driving it forward, maybe the pandemic being an accelerator, or then just being able to have this sort of high-level view of lots of data to benchmark success and learn from each other. Let's take this quick poll. You can go in and select one of the following. And in the meantime, let's talk a little bit about the future. Tamara, where do you think this is all heading from a population health standpoint?
Well, actually, just looking at this slide, I would struggle to answer, because I think I would pick the first three, all three of them, to be honest. And, we already see that the bundled payment care is moving the model to where you have mandatory participation in bundles that you didn't have to do last year. And we already see that we have evolution of the innovative models through moving forward with the DCE, or the direct contracting entity model. And we see commercials sort of, as always, they sort of follow suit in some of these programs that come through the federal work, and try to implement similar type models themselves with the commercial populations. And then we already see market consolidation. We've seen some biggies happen this year, those that I will keep nameless, but I think we've seen a lot of that happening, and we'll continue to see that happen. So yeah, I think that I think we're going to see a lot of shift over 2021 and into 2022 as well.
Anna, do you agree?
I would say I would check all of these boxes because they're already happening. And then I would say, if we're really thinking about the future, I would check the other box. And my other, if there was comment on this, would be really that on a foundational level, we are coming together as a healthcare ecosystem, payers, vendors, providers, gyms, the YMCA, whoever, is in that healthcare ecosystem. There's so many players. We're coming together to figure out, how do we share our data? How do we connect this story with patients? How can the federal government help us do that through standards? How can we hold the accountability and the execution of those things to make it all happen? And so I think all of these things are already checked, and that we're really looking towards a future where we're building infrastructure to enable us to really personalize that medicine, that coaching, that care, that healthcare that we always envisioned healthcare being, a partnership of the ecosystem, even with the patient. So that's my view of the shift in 2021 and beyond.
Let's take a look at what the audience thought when they were forced to pick one.
Yeah, we weren't forced.
and pull up the poll results and take a look. Still waiting. Well, it looks like they were evenly split, and benchmarking seems to be an opportunity for the future.
Yeah, well, absolutely.
That said, let's and that makes sense given our discussion. So let's take a look at what the future may look like. We've talked a lot about kind of where we're at, what we're learning, where we may go. What do you think this future looks like? Anna, let's start with you.
Yeah, I think it's more personalized. It's the right care at the right time in the right place. That might mean a hospital at home. You might not need to be in an inpatient unit getting the care you need. That may be more appropriate at home with some. Now that we have these devices and innovations that can come along with us in the field, that's enabling us to put care where it should be or meeting the patient where they are. So I think the future is using the data, the interoperability, the aggregation of all this information to really customize healthcare for that patient, meet them where they are. If they have asthma and they're going to the ED 5 times and they need an air conditioner, we're moving the dollar around so we can get them that air conditioner to live that better life, not necessarily see them in the ED all time. So it's shifting the mindset around what health is. It's that new word, the CDC even defines it, well-being. I don't know exactly how, but it's meeting the patient where they are and shifting the care where it is and using that data and information to figure out who needs it the most, that equity and equality, all of that, putting it into that equation of getting the care to those that need it the most where they are.
And it's interesting, I've got a bunch of questions flowing in from the audience asking what was the underlying technology you're using to achieve interoperability? Are you using third parties? It all speaks to this last bullets. Do you want to take a stab at that?
Oh my gosh, there's so many. So just as complex as healthcare is, or diagnosing a patient is, so is interoperability. So we use several platforms, but what I really want to speak to is the standards. So we've been really focused in on moving towards FHIR, using the use cases in Da Vinci, and picking partners, innovation partners like Innovacer, who can aggregate data for us, who can do some of the plumbing for us. So we use several different types of platforms to make that happen. We're moving toward a more FHIR-enabled organization so that this data can be standardized as we move it between entities and organizations. And we have many technology vendors that we utilize to make that happen. Many partners, I would say, not just vendors. Innovacer is one of them, and they help aggregate our health information and really center that data around the patient. So what's been hard is you have all this data, and now we need to get it in one place and look at it in one way, from one lens, from that patient lens. So this is one platform that enables us to do that.
And Tamara, do you want to speak a little bit about your perspective as the population health engine driving this?
Yeah, I think that Anna is working in a large system with large payers, and we have that perspective, but we also have the independent perspective. And so one of the benefits of the Innovacer platform for aggregating data for us was that they're really good at taking any kind of data and mapping that data so that it becomes that integrated record, no matter what form or format that we are able to capture it in. Again, a single doc shop is not going to have they don't even have, the technology person in-house to help them do this. So part of what we get through the benefit of using the Innovacer platform is their technology folks help us capture that data in a format that we can use it in the Innovacer platform. So while we strive to do the FHIR methodology for, our bigger entities that we work with and partner with, we also have to really make sure that we can assist and meet some of those smaller clinics where they're at in that technology trip.
That makes a lot of sense. Well, we have time for one or two more questions here. Here's a question. Was your population health management program inclusive of all network physicians assigned membership, or exclusive to a handful of physicians that you focused on in terms of the success of your population health program? Anna, do you want to take a stab at that?
Yeah, so I would say that a lot of the activity, going back to that primary care provider, that we focus heavily on how our primary care providers interact with the patient, because they're like the head coach of the football team. There's a lot of specialists on that team. There's the defensive end, there's the quarterback, there's all of that, but they're the head coach, and we focus a lot on enabling those head coaches to be successful in closing care gaps, ensuring that we're coding properly to the patient's with our HCC codes. Those are that's who we focus in on the most. And then as we mature and get more and more advanced as a population health in our practices, we start focusing in out on care pathways. Like, what is the care pathways for somebody with diabetes? What is the care pathways with somebody with COPD? What are those walkways, and who's involved in those walkways, and how do we make that happen? But initially, we focus in on primary care providers.
Yeah, well, I can say, being involved in an early part of this journey myself, and then working with my colleague, Dr. Paul Grundy, who is now here at Innovator as well, the godfather of the patient-centered medical home. The two of us worked very closely with the Obama administration years ago in trying to get primary care as a foundation for this accountable care. I just really am thrilled to hear that perspective from you. This really concludes the time we have for the webinar, and building the future of connected teams, a story of innovation. It's just really exciting to have both of you here. Thank you both so much for sharing your experiences and your collaboration with us.
Thank you, Dr. Nace, for having us.
Thanks for having us.
And thanks to all the audience. We will follow up and provide you a copy of this slide deck so that you can learn from the experience you heard about today. And we'll also send you a little packet of information around Innovator, which has been winning many awards for supporting the kinds of teams that you heard here today. So with that, this concludes the webinar. Thank you very much for attending.
Thank you.
Thank you.